So this is video 15. We will continue with plan and action and activity. So we have seen that there have been 3 programs under this national program for control of blindness. So we will see what is the first one, which is a basic program components. So the basic components of NPCB is its inception include the following. So what are those? First one, under that, extension of eye care services. So it's being done through the state and district mobile units by adopting an eye camp approach and by enlisting the participation of voluntary organization. The following facilities are provided in remote areas. So what they will do is, mobile units is where they will go to the remote areas and they will do the survey by doing a checkup of the eye and find out how many are affected with any kind of disorders that is associated with the eyes. So they will be doing medical and surgical treatment for the prevention and control of common eye diseases after the camp. Eye camp approach is of great help in reducing the backlog of cataract by mass surgeries. Recent emphasis is on reach-in approach. So because they go and conduct, they are able to rule out the cases and immediate treatment can be given. Then detection and correction of refractive errors. So these are certain disorders which can be corrected. Okay, so various we are seeing like how they treat this cataract and then glaucoma cases, then refractive errors, then thorough ocular examination, that is eye full examination including vision of school children for early detection of eye diseases and promoting ocular health. Rehabilitation training of visually handicapped. So rehabilitation training are given for people who are visually handicapped. General survey for prevalence of various eye diseases. So they also conduct a survey and they see how much of the prevalence of the eye diseases are there. Secondly, establishment of permanent infrastructure. So the ultimate goal of NPCB is to establish permanent infrastructure to provide eye care services. It is being done in 3-tier system, that is peripheral, intermediate and central level. So they're making sure that they are building up with the infrastructure or eye clinics where they can go and get treated. So it is done at the periphery and then intermediate and central level. Okay. Thirdly, intensification of eye health education. So intensification of eye health education is being done through mass communication media like television talks, radio talks, films, seminars and books, school teachers, social workers, community leaders, mobile ophthalmic units and existing medical and paramedical staff. Main stress is laid on care and hygiene of eyes and prevention of avoidable diseases. So health education through various means, IEC and to all, like school teachers, workers, community leaders, okay, regarding mobile ophthalmic units, everything has been given so that they would be able to avoid diseases. Okay, so these all comes under the first program, that is the basic program component. Secondly, we will see program organization. So there you see a diagram. So which is done at the central level, state level and district level decentralization. And then we have already seen that we have to do in 3 tertiary levels, that is 3 levels, that is primary, secondary and tertiary. So when we say district, it is only the district health society that is involved. State level, you have state ophthalmic cell, Directorate of Health, state health societies. And then central level, you have this national program of control of blindness. And then you have DGHS, MOHFW. So we'll be seeing that. Okay, so primary level, when we say district health society, same. Okay, and then you have the state ophthalmic cell in secondary level. Tertiary, regional institution of ophthalmic and center of eye care and medical college establishment. Okay, so these are the program organization, at what level they can provide care. Okay, so what are the activities of these programs? That is the annual eye checkup of all incumbents. So annually they will go they'll make sure that they're blinds, they will be doing checkup of blind schools covering the visual activity fundus examination, other appreciate advanced tests required to assess chances of visual restoration. So they will also go to the blind school and they will do a checkup to see how we can restore their visualization, in what ways. Then eye checkup of applicants who desire to seek admission in a blind school, and issue of certificate of incurable blindness recommending admission to a blind school. No person would be admitted to blind school without this certificate. So they have to undergo this eye checkup, applicants, okay, for the applicants who desire. So if they want to get entry in blind school, then they have to get a certificate stating that yes, this child or a person is blind and he can be admitted. Okay, so this is the activity of the program. And then next we see follow-up of treated cases. Whichever cases have been treated, they have to come for follow-up. Rehabilitation of incurable blind would be as per scheme, Department of Social Welfare. So people who cannot have restored eyesight itself, for them they will be teaching rehabilitation works like making of candle, making of agarbatti, making of flower vases. They will teach them, okay, and they will refer them to a social welfare service so that they will be able to depend on their own earning. Then low vision aids to screen all school children, refractive errors they find out, okay, free of cost they conduct the screening for all the school children, and they will see if any kind of eye disorders are there, and it will be treated. So eye checkup of incumbents of blind school, including special investigation. So as we have seen earlier, for blind school also they will go and they will do the investigation to find that if at all can we restore the eyesight by any means. So that's why they do this examination. And then 100% achievement of cataract operation, of which 90% will be intraocular lens, placement of the lens in cataract patients, okay, and 10% for simple cataract surgery 2009 to 10. So they have made sure that cataract patients are treated well. Okay, so operation where they keep the lens, okay, intraocular lens for 90% and 10% for simple surgery has been performed during the year 2009 to 10. So these are all the various activities of the program. Next we will see what is a strategic plan for Vision 2020. So the right to sight in India. Okay, so the right to sight in India. So adopted at a meeting held in Goa on October 2001. There was a meeting which was held in Goa and constitute a working group. So group of working people were constituted for the meeting. Then the draft plan of action submitted by the working group includes. So this working group has given following strategies. So we will see what are those. So mainly, there are 4 strategies that they have introduced. So for the welfare of the people, and the plan is strategic plan is for Vision 2020, and the motive of that is the right to sight in India. So strengthening advocacy. First they say that we have to strengthen, so in order to prevent these kind of blindness, we see that public awareness should be given. The introduction of topic on eye care in school curriculum, it should be added. And then professional organization of all India Ophthalmological Society should be included. Eye banks Association of India, so where eye donation is done, so it will be stored in the eye bank. And all medical, okay, an Indian Medical Association should be involved in the NPCB to strengthen the functioning of District Blindness Control Society. Okay, so that's what we say, DBCS, to enhance involvement of NGOs, local community, society and community leaders. So they're saying in order to strengthen the advocacy, it is very important that we create a public awareness and information should be given about the eye care, prevention of the blindness. School they have to go, and all the organizations should unite together in order to bring to strengthen the medical or the treatment for the eye by ruling out the eye disorders. So we require equal participation of all the organization. Then to strengthen hospital retrieval program for eye donation through effective grief counseling by involving volunteers, forestry department, police, etc. So also making sure that so retrieval for eye donation, okay, so we have to make sure, okay, effective grief counseling by involving volunteers. So people who want to do, okay, for that encouraging them, we can have volunteers and other personals involving. So these are the various methods how we can strengthen the advocacy. Next we will go to reduction of disease burden, that is the number to be brought down. So target disease identified for intervention Vision 2020 initiative. So they have included certain diseases on which they will be targeting to reduce the incidence and prevalence cases like cataract, childhood blindness, refractive errors and low vision, corneal blindness, diabetic retinopathy, glaucoma and trachoma. Okay, so these are the diseases that they have been focusing. And then human resource development, that is mid-level ophthalmic personnel, hospital based MLOP. So ophthalmic nurses, ophthalmic technicians, optometrist, orthoptist, all these people are involved, human source to be empowered. Then community based, you have people mid-level ophthalmic personnel like primary eye care workers, ophthalmic assistants. So all these people have to be involved, training has to be given, and manpower has to be provided, and that has to be strengthened. Then when we are talking about eye care infrastructure development, we see that it is done at primary, secondary and tertiary level. So primary, when you see Vision Center 2000, okay, you have to 20,000. So here, sorry, it is actually 2,000, okay, excellence, okay, 20,000. So here we see refraction and prescription of glasses. So at primary level, when they identify there are, refractory problem, they give glasses, primary eye care, school eye screening program is done, and screening and referral. So usually they screen, and for basic or, minimum level of refractory problem, they give glasses. Secondary level, when you see, they do the referral, they facilities for refraction also is done. Other common eye surgeries, they also perform at secondary level, cataract surgeries and other eye surgeries. Tertiary level, when we see, we give professional leadership, we train leadership, medical education, research is being carried out, and then laying of standards and QA, okay, and then you have strategy development, okay. So they, by question and answering, okay, so various questions are answered, and according to that, strategy plans have been developed. Good, laying of standards are done, and then research is conducted, continue medical education, professional leadership, leaders are trained, then training. Tertiary eye care, including retinal surgery, corneal male important surgeries are performed at tertiary level, and then corneal transplantation, then glaucoma surgery, training and medical continuing education. So this is all the proposed structure of Vision 2020, primary level, secondary level and tertiary level, that is carried out. Okay, so with this we are completing with the National Control of Blindness program. Okay, so next we will continue with next program, that is National Iodine Deficiency Disorder Control. So when we say, this you should have also studied in your nutritional programs. Okay, the nutrition, okay, introduction, when we say iodine is an essential micronutrient, it is required at 100 to 150 micrograms daily for a normal human growth and development. The disorders caused due to deficiency of nutritional iodine in the food or diet are called iodine deficiency disorder. So when there is a deficiency, it leads to IDD, iodine deficiency disorder, and then these are actually found, as a worldwide problem, major public health problem too. These affect a large segment of population in all continents, and more than 1.5 people all over the world are at risk of iodine deficiency disorder. So burden of Indian population, you can please go through this tabular column and you can see how many cases in rural, urban, and how much are the total, cases among the newborn infants under 5, pregnant women, and total population. Okay, please by heart it. And then we see the phases. Under the phases, again you have phase 1. So phase 1, we see that research leading to program. So they have done research, okay, which brought into the emphasis of the program. Then phase 2 we have seen. So phase 1, 1956 to 1983. So phase 2 started from the year 1983 to 2000. So from goiter to iodine deficiency disorder were identified. Phase 3, 2000 to 2005, lifting of ban on sale of non-iodized salt. So they made sure that iodized salt was provided, and they lifted the ban which was there before this, third phase. And then phase 4, 2005 to 2012, reinstating the ban on sale of non-iodized. Okay, so they made sure that iodized salt was provided. Consolidation of sustainable elimination of IDD was done. So there are totally 4 phases. Okay, and it is not mentioned in detail. So this you can remember the flow chart and the contents that is given in the flow chart. Next we will see NGCP. NIDDCP, we'll see what it is. That is Government of India launched NGCP, that is nothing but National Goiter Control Program, in 1962 with focus on providence of iodized salt in identified endemic area. So whichever area were affected with iodine deficiency, they made sure that iodized salt was distributed. The nomenclature of the program was changed in August 1992 to NIDDCP. So from National Goiter Control Program, they changed the nomenclature, that is the name, to National Iodine Deficiency Disorder Control Program, to emphasize wider implication of iodine deficiency. So to bring down this iodine deficiency in a wider range, they had to change the nomenclature, okay, to NIDDCP, that is National Iodine Deficiency Disorders Control Program. So when we see the goal, the World Health Assembly adopted in 1991 the goals of elimination as a public health problem. Okay, so they made sure that it should be completely eliminated by the year 2000 AD, and then in 1992 WHO and UNICEF recommended universal salt iodization, that is USI, as the main strategy to achieve elimination of IDD. Okay, so universally this salt was given, that is iodized salt, which prevents iodine deficiency disorder. So this has been the goal, elimination and distribution of iodized salt. Talking about the objectives of the program, okay, we'll continue the next video.